And we're live. Hey, everybody. Thank you for joining us today for another episode of Kidney Cancer Conversations. And I'm very excited to have our guest today, Katie Coleman. Thank you for joining us today, Katie.
Yeah, thanks for having me on and for the opportunity.
So, Katie she was diagnosed a few years ago with a very rare subtype of renal cell carcinoma. And today she's here to tell us a bit about her journey and some of the things that she's been up to after she went through that journey. So, um, without further ado, Katie, would you please share your journey with us? And let's start with when you were first diagnosed and with the rare kidney cancer and what your experience has been like.
Yeah, so I was first diagnosed in December of 2020. Actually, on New Year's Eve was when I walked out of the ER. So, not quite the way I expected to start off a new year. I was a newlywed at the time. My husband and I had just gotten married 2 months prior. And I had been kind of dealing with some health issues for a number of years that everybody kind of just thought was anxiety or kind of had to do with just kind of like my menstrual cycle and stuff like that from being a woman, because I was getting severe lower abdominal cramps. And so I was pursuing medical appointments for a number of years, trying to figure out what was wrong with me. And then eventually, after my husband and I got married, we were planning to start a family. We were building a house. And so I started going back through the process to try to see if I could get a more definitive diagnosis or make sure that it was safe to have kids. And through that workup process, I found some new doctors. And then I started feeling a hardness in my upper right abdomen. And that hardness ended up being, I actually have a 3D model of the tumor. So this was the tumor that was on my right kidney. It was about 12 centimeters. And so that's what I started to be able to feel. And when it wasn't taken very seriously in my primary care appointments, I just had this nagging feeling that something was wrong. And so I ended up going to an urgent care to get it checked out. And then once a nurse practitioner felt it there, they also thought that they felt it and they thought maybe it could have been enlarged liver or wasn't really sure what it was, so that they sent me to the ER. And then that is where they found kind of stage 4 kidney cancer for me there in the ER. We assumed that I was kind of stage 4 right at diagnosis because I had that very large tumor in my right kidney. And then at the time, because my first scan wasn't super great, we thought I had about 6 tumors in my liver. That would end up being about 15 or more tumors that ended up being in my liver.
Wow.
As we went through the diagnostic process. So we kind of went from there through biopsies and to confirm what I had, which actually ended up coming back as at the time, we didn't know it for sure, but a metastatic oncocytoma, which is exceedingly rare. Oncocytomas are typically known to be benign. Mine just didn't catch that memo, and it spread to my liver. And
Jeez.
so that's what gave me the super rare kind of diagnosis and kind of where I went from there.
So you mentioned that they weren't really sure at first. What challenges did you face in getting an accurate diagnosis? And how did you go about navigating it?
Yeah, so basically when I was first diagnosed, because I was already kind of assumed metastatic, we weren't going to take out the tumor for my kidney. And so we did a biopsy of both my kidney and my liver. Through that process, we actually found that I have a bleeding disorder. I had a small internal bleed during my biopsy of my liver. But once we got the samples back, it said I had an unclassified oncocytic neoplasm, which my oncologist at the time told me was rare. I was at an academic center in Utah at the time. But we didn't know exactly how rare it was. And I was in this unclassified bucket, which is kind of just a bucket full of tumors that they can't classify. But I was very, very, very fortunate to have a pathologist that was really thorough in the notes that he put in that pathology report. And I knew nothing about cancer at the time. I literally didn't even know what an oncologist was. But I was able to access my records online. And so I slowly started teaching myself piece by piece, like the terminology that was in my pathology report, um, that helped me kind of learn and piece out the fact that what I had seemed like it was pretty rare. And it was actually a video from the Judy Nicholson Foundation as well that helped me during that period of time. You
Know
actually
that.
recorded a video with my oncologist that I have now 2 days before I had my biopsy that confirmed my cancer. And in that video, he was talking about the importance of knowing your subtype and how they all respond differently to treatment. They were originally going to put me on an immunotherapy, which, due to my subtype, I most likely would not have responded to. And it was watching that video that kind of helped inform me that I should probably go for second opinions and try to figure out what this thing is a little bit more. So that's how I traveled from Utah, where I was at the time. I went down to MD Anderson to get a second opinion. And then through a series of events, 6 months later, even ended up at the NIH, which is where we officially confirmed my diagnosis as a metastatic oncocytoma.
Wow. I'd like to back up a minute to talk about when you received that diagnosis, and how you felt emotionally and mentally. What was going through your mind at the time?
Yeah, so it was actually kind of crazy. I felt two different things. So when I very first got the diagnosis in the ER, the very first emotion I felt was relief, which was mind blowing and not something that I never would have imagined getting a stage 4 diagnosis. But I felt like I had something wrong with my body for a number of years. I kept asking doctors if I had cancer or if we could rule it out. And I was kind of told I was too young and that it was just anxiety. And so in the ER, my initial feeling was relief of like, somebody believes me. Like,
That's amazing. Wow.
it makes sense that something is really wrong because I felt like something was wrong. And
Yeah.
so I had a very, very compassionate doctor in the ER that broke that news to me. And so for the first time, I felt like I had somebody on my side who believed me. That only lasted for a short period of time. And then the actual weight of the diagnosis did set in. And then I was just devastated. Like I said, I was building a house. We were planning on starting a family. I was a newlywed. And so I felt like I had built up my entire life to like finally get to a stable point and start kind of living out the life that I expected to live. And then all of a sudden had this dropped in my lap and didn't think that I'd have much of a life anymore. So I was pretty shattered immediately after that. And other patients and connecting in support groups is really what helped draw me out of that during that period of time.
Thank you for sharing that. Um, what what can you tell us about the treatment options that were presented to you, and were there any that you decided to, well, you said you decided against immunotherapy besides because of the subtype.
Yeah, so I actually decided against several treatments, and so much of that was that's why I always really advocate for patients to learn as much as they can about their disease, because it was learning about my disease that helped me make those decisions. Even though my cancer is so rare, we didn't really have a whole lot to go off of, but they were kind of best guesses. So initially, I was offered an immunotherapy and TKI combo. When I was first diagnosed, I was told we couldn't do surgery because it was already metastatic. And because I had the bleed during my biopsy, they were thinking of dropping the TKI as well, since that can cause bleeding tendencies, and we were only going to go with the immunotherapy. And so it was learning that my type of tumor, oncocytomas, share a lot of similarities with chromophobe kidney cancer. And so in the beginning, since there's really no treatment plan that you can go off of for an oncocytoma, we were really basing my treatment plan off of chromophobe kidney cancer and things that chromophobe kidney cancer does and doesn't respond to.
Shout out
And
Tracy.
what was that?
I said shout out to Tracy.
Yes, exactly. And the chromophobe kidney cancer oftentimes doesn't respond super well to immunotherapy. And so that was one of the things that I actually even learned in the Judy Nicholson video. And so that was part of what prompted me to get a second opinion. After that, I was also offered a trial at MD Anderson. Surgery initially at MD Anderson with the first physician I was at still wasn't possible. I got several second opinions from other centers as well too, where surgery wasn't possible. But I was offered a trial for 2 TKIs for Cabo and Sutent. I had access to both of them outside of the clinical trial as well. And so I personally passed on that clinical trial for kind of a number of different reasons as well. I didn't think my case would, I actually thought my case might not help other people, that it might hurt because my tumor was so much different than everybody else's, as well as a number of different reasons. And then I eventually ended up starting on cabozantinib as my first line treatment before I finally needed a surgery.
Of the support system that you had when you were diagnosed, can you tell us a little bit about that? Were your family and your friends real supportive?
Yeah, so like I said, I lived in Utah at the time, where I originally grew up when I got diagnosed, and my family and friends were incredible. They were very supportive in the beginning, but I also did get diagnosed in the middle of COVID. And so I had a whole bunch of appointments that I could not risk missing, or missing scans or anything like that. So I didn't get to see my family and friends a lot. And then
That had
eventually
to be.
yeah, it was pretty tough in the beginning. And that's also where I learned and leaned so much on support communities, and why I connected so much with other patients, especially after I moved down to Texas, because I didn't have a whole lot of friends and family down here. And so I really connected with other patients and support groups. And that has probably been my biggest support system. Other patients helped me learn about my disease. They helped comfort me when I was posting in support groups at 3 a.m. because I couldn't sleep and I couldn't stop crying, because I just had no hope. I get a little teary-eyed talking about those things. So
That's
so
okay.
much of what I do now is because of the patients that supported me through that period of time.
Are there any support groups that anyone on this call or anyone that may be listening to the video later that you'd like to name or shout out that they may find interest into?
Yeah, I mean, honestly, I think there's so many support groups in the on Facebook specifically, and then there's also Smart Patients, which is
Big
another,
fan.
yes, external kind of like forum style support group. All of them are great. The Judy Nicholson one on Facebook, as well as there's a couple stage 4 groups. Those are ones that I found very beneficial. And then I was able to connect through there's 2 chromophobe kidney cancer groups. And I connected with a bunch of chromophobe kidney cancer patients that really kind of took me in as their own, even though I had this weird kind of cousin to chromophobe kidney cancer. And that really helped to influence why I do so much for chromophobe kidney cancer now, and why I built a nonprofit to help fund research for it too.
And we certainly want to talk about the nonprofit and some of the other things that you're doing to sort of pay it forward or pay back the community that you found help in before. But before we get to that, could you share some insights on how the kidney cancer diagnosis impacted your daily life? How did it change things for you?
Yeah, so it's impacted my daily life in different ways depending on where I was in treatment. At the beginning, like I said, I was just shattered. So I pretty much didn't feel like I had the capacity or bandwidth to do pretty much anything. But trying to juggle figuring out how to get second opinions, insurance, get approvals for things, all while trying to work full time, was something I definitely struggled with at the beginning. And then once I started treatment, I had side effects that I then was having to kind of deal with, and just try to manage to get throughout the day. I had a lot more fatigue when I was on treatment. And so my days looked a lot different than they do now. A lot of that was like trying to prevent side effects, like using lotion on my hands and feet 3 times a day, always putting sunscreen on because I burned like crazy, or just managing the different side effects that were popping up for me while I was on treatment took up a lot of my time outside of work, which was kind of to help make sure that I could stay on insurance for my treatment. And so my days during that period of time looked a lot different than they do now. For example, now I'm off treatment. I don't have any long-term side effects or anything that I manage. And so my day-to-day kind of as I was going through treatment was kind of just to try to put one foot in front of the other and to just get through it. And now my day-to-day has kind of turned to like, what can I do to kind of help somebody else or try to lend a hand down to somebody else who may currently be in that position.
How has this experience changed your perspective on life and health and well-being? Are there any lessons or wisdom that you'd like to share with others that are facing similar challenges?
Yeah, it definitely completely changed my perspective. I actually am happier than I ever have been before. And I've even said, like, I mean, I don't know, you could ask me down the road if things don't go well, I might change my opinion one day. But I feel like I've lived more in the last 3 years than I lived in the 29 prior to that. And those years have meant more to me than anything. And so I feel like kind of no matter what comes after this, like I am beyond grateful to have been able to have this time that really reshaped and framed my perspective. Having cancer really made me evaluate like living in the moment. I used to always plan my future out and try to plan big things. And when I was initially diagnosed, I was still trying to do those same things. And it like really hurt. I'd get really depressed and worried about like, oh, I can't plan a vacation next year because I don't even know if I'm going to be here next year, or will I even be able to get on a plane? And I don't want to let people down. And so I really struggled with that in the beginning until I started shifting my focus into focusing on how I felt in the exact moment and the things that I could do currently. And so for me, that ended up being like appreciating the fact that I could go for a walk one day. Like, even if I had side effects and everything else that I was dealing with, like I knew today I could go for a walk, and I never knew when that would be taken away from me. So if I could just appreciate that time now, I could live in that moment and not worry about what comes in the future. And that stuck with me afterwards, since I've been off treatment as well too. Is I still go for scans and we still are on surveillance. And so I kind of plan my life by only in the time of certainty that I have until my next set of scans. And that's when I try to do all of the things that I enjoy and take advantage of the fact that I know how I'm probably going to feel in this predictive window. And living that way has made me happier and honestly helped me accomplish more than I ever did before.
Love that. What was the transition like for you being from an inactive treatment to being cancer free?
Yeah, so I even still have a weird like feeling with the terminology cancer free. Like I'll still knock on
Sure,
wood.
because lots of people get told cancer free and then scans later change that opinion.
Yeah, exactly. And even no evidence of disease, the very first time I heard that, I feel like I kind of pulled it out of my oncologist a little bit because NED is really just a snapshot in time, right? It's what the scans are showing at that one particular time. And for me, I was on systemic treatment for a few months, and then I ended up getting to a surgery at the NIH where they removed my right kidney. We did several wedge resections of my liver, and then we burned about 10 tumors in my liver as well. And then a couple months later, we went back and we burned some more tumors in my liver. That entire process took a lot to heal from that surgery. It was a very large surgery, but that has kept me off treatment, and so I haven't been on treatment since then. And so we still have a few spots, for example, that have been in my liver ever since we last treated me, and actually since my initial diagnosis, but they've been stable so long that they now call me no evidence of disease or no active cancer, just because we can't really tell what they are, but if they were cancer, we would have expected them to have grown by now. And so that's where I kind of live in this world sometimes of like, it took me in order to even hear no active cancer for the first time, um, about a year since my very last procedure. And that was coming up in like November. Here will be 2 years from the last time I had my ablations. And so there was a really long period of time where I didn't know. And like I was just living in this world of like, I don't know what's going to happen. I guess we'll figure out kind of as each scan goes along. So I still feel like I kind of live in that world, even though I'm very grateful to be off treatment. I still kind of always live in that world of I'm always hoping for the best, but recognize that it's one scan at a time.
Hmm. And do you find yourself, how often do you get scans going? Like, have you had one recently?
Yeah, so my last scan was in the end of June. It was actually the 2 year anniversary of my surgery. And I started for the first couple years, I was getting scans every 2 to 3 months. And then I started getting scans every 4 months. Then we went to 5 months. And then this scan schedule will be the first time that we will be at 6 months, which will be in the like December timeframe.
How do you feel
November.
about that? Are you excited about the less frequent scans, or are you like, I don't know, I kind of feel like I want one next week?
A little bit of both. My doctors probably told me I could go to 6 months, probably at the beginning of this year. But I wasn't quite ready for that. I wanted to baby step our way there just because I do have these spots in my liver, right? And so there's always been some paranoia for me of like wanting to watch those very closely.
Hmm.
Um, so I don't know, it goes both ways. I also have really enjoyed like being able to plan a lot more because I know what 6 months is going to look like instead of knowing what 2 or 3 months is going to look like. I can plan a little bit better,
Mhm.
um, which has been nice. But there's also definitely some anxiety that comes along with it, knowing that we're stepping up that surveillance period in between.
So after being pronounced NED, do you find yourself the uh, I lost my I lost my place. Hold on one second.
Hate when that happens.
I was wondering if you found that there was any uh, changes to like your diet or your lifestyle, or ever since, like, when did you, if you made any of those changes, did they take place like when you were diagnosed, or did you change your sort of your plan later? What how did it affect your diet and your activity and that kind of thing?
Yeah, so I actually changed and so I was tortured by the whole everybody making recommendations about what you should and shouldn't eat when I was first diagnosed. There was a point in time where I just opened my cabinet and just stared into it and cried because everything I looked at was something that somebody else told me would cause cancer or I shouldn't be eating, and I just felt guilty. Um, and so I've tried a little bit of everything. So before I was diagnosed, I actually started eating healthier and exercising because I couldn't get people to take me seriously. So I thought, okay, at least maybe I can try to take my own health into kind of my own hands. And so I
What do you
lost
mean
about,
you couldn't get anyone to take you seriously?
so I felt like something was wrong. And I was getting severe pains in my lower abdomen, for example, that we found out was probably the tumor bleeding. But at the time I was just told that that was like my normal menstrual cycle, even though it didn't line up. And I had high blood pressure and things like that, that they just told me was anxiety. And so when I struggled to get people to take my symptoms seriously, I thought, okay, well, maybe if I lose weight, it'll help relieve some of those symptoms. So that was the route that I was kind of going for there. And I lost about 50 pounds through that process. I was walking between like 2 and 10 miles a day, like extra walking upon just normal walking. And then I also was eating really well. and mainly a plant-based diet. And then after I got diagnosed, again, like I said, I really struggled with everybody saying like, you should eat this and not that. And I started losing even more weight, which my doctors were advising me against, because you can lose weight on treatment, right? And so we didn't want me to be losing any more weight. And so then I really struggled with, okay, how do I keep this weight on? And so I had to start drinking protein shakes and replacing the calories every time that I went for a walk. So when I was on active treatment, my diet actually revised. I was eating a lot of really high fiber foods before I was on active treatment. And then to combat some side effects while I was on active treatment, I worked with a nutritionist at my cancer center. And like sometimes I had to make revisions to my diet so that it would relieve some of my symptoms. And so I kind of changed and went from a really high fiber diet to other times I might be eating like more white bread and just regular white rice and stuff like that versus brown rice because it was helping my symptoms at the time. But I think each of that kind of depends on every patient's scenario. If I was on a different treatment, I probably would have had a different diet based on other research that I feel like is coming along with some of the treatments and the importance of the gut microbiome.
Mm.
And then I also like after I got to kind of no evidence of disease or my last procedure that I had, I ate extremely healthy to see if my scans changed at all. I went back to eating normal to see if my scans changed at all, and kind of everything in between, just to give myself peace of mind that I could stop torturing myself over if I wanted a piece of dessert at dinner. And so now I kind of just try to take a balanced approach to kind of diet and exercise with it all.
Good. Balance is healthy. I love that. The Have you experienced any long-term effects or lingering conditions related to the treatment that was involved? Was it cryoablation? Is that the scientific term for them freezer burning your tumors?
So mine was, that is one of the ways you can ablate it. Mine was actually microwave ablation. So we burned them, like we
Oh,
heated
okay.
them really hot. And then we did surgery for most of my tumors. And I thankfully didn't have, that's where I realized how truly fortunate I am. And I feel very, very grateful that a lot of patients who reach no evidence of disease may have side effects or that they're dealing with after they come off the treatments that are kind of lingering side effects. I don't really have much of any. I might maybe get a little bit spacey sometimes. And that I don't know if maybe that some of the brain fog might have come from treatment, but other than that, I don't really have any long-term side effects that I'm dealing with. My liver, if you look at it on a scan, kind of looks like somebody might have taken a shotgun to it. It doesn't look the best, but my liver functions normal. My liver was able to recover just fine. And I thankfully don't really have anything else that I actually feel better now after treatment and after going through everything than I did before I was ever diagnosed for many, many years.
Awesome. Patient advocacy can be a advocacy can be a powerful force in raising awareness and driving progress in the field of rare cancers. I know that it's been important to you. Would you mind sharing with us the things that you do?
Yeah, absolutely. So that's like probably the most important thing to me. And like I said earlier, so much of that did come from other patients who really supported me early on, as well as when I very first was diagnosed. I was looking at my cancer and realized that it was super rare. Like there's single digit case reports for it, which was why I started sharing on social media initially, is I realized there was no information for me to go off of or for me to even bring my doctors to ask about. And so I started sharing my case online, and I personally made the choice to share all my medical records and everything very, very openly, in the hopes that if anybody else found themselves in my shoes one day, they could find my information. I didn't think that I had much control over if they'd ever write a case report on me, but I could at least give people some anecdotal information on what worked for me and what didn't. So I started sharing my story online in the very beginning, kind of just sharing that process and then what it was like to be diagnosed with cancer, because at the time I had no idea what it looked like. And I didn't know what life was going to look like for me going forward. So I wanted to hopefully help any other patients that ended up in my shoes. So that's kind of what started all of my social media stuff. And then, like I mentioned, I connected with a few patients who had chromophobe kidney cancer. And it was as we were going through my diagnostic process when we thought I might still have chromophobe kidney cancer during a certain period of time. And when we used chromophobe kidney cancer as kind of my treatment plan, that I learned and found out how little information there is on rare cancers and how little research there is, as well as treatments available. But I also learned how crucial it is to know your subtypes and for there to be research and treatments for each specific type. Because like I said, kind of earlier in the call, chromophobe kidney cancer, for example, doesn't respond as well to traditional immunotherapies as like clear cell does or some of the other types of kidney cancer. And so it's really important to find treatments that are tailored towards each specific subtype. So for chromophobe to have something that matches its biology better. And so I worked with, there was a group of us, there were 6 of us women who helped fund the first ever chromophobe kidney cancer grant that actually went through Casey Cure. And we were able to fund kind of the first research to kind of push off and fund research for chromophobe kidney cancer. And then I got to see what a big impact that was. I mean, that was 6 of us and a whole bunch of people who were willing to support and kind of join us in those efforts that were able to fund a grant for research that hadn't been done in a really long time. And so that really stood out to me, the importance of like, you can make an impact and you don't need a big group in order to do it. And so I ended up forming my own nonprofit at the beginning of this year, the Chromophobe and Oncocytic Tumor Alliance, to kind of further amplify those efforts. And the KCA has also they funded a grant for chromophobe kidney cancer this year. And I'm working to fund a grant for chromophobe kidney cancer next year as well too. And so all of that kind of being dropped into the rare cancer space and seeing that there was a need and that it doesn't really take much of an effort to kind of get the ball rolling. I mean, I say much of an effort. It definitely takes effort, right? It took a lot of effort from a lot of people to get it started, but it wasn't an insurmountable amount. And so that's kind of led me to kind of where I am currently.
That's awesome. And so you wrote a memoir, and the proceeds are being donated to kidney cancer research. Can you tell us a little bit about that?
Yeah, so I definitely never considered myself a writer before, but this whole doing new things and trying new things and was kind of all part of it for me. So as I was going through my diagnosis, I had a bunch of people that kind of asked, they wanted to hear more and for me to share my story and what it was like to navigate having a rare cancer. So I wrote a memoir about kind of my entire process and from when I got diagnosed all the way through to kind of where I am currently of no active cancer and all the steps that it took to get there in between. And like I said, I wrote that wanting to give back because I made it to a surgery that I know a lot of people don't have access to and wouldn't have the chance to get. And that due to the rarity of my cancer. And that completely changed my prognosis for me. When I was initially diagnosed, my treatment options weren't curative. It was really hard to pull prognosis out of anybody. But it was like, I was told in one appointment from a doctor that they didn't think that I was going anywhere in the next 6 months to a year, but we didn't really have a whole lot that we could expect after that, or we didn't know what we could expect. Again, now that I know the way that they talk now too, that was probably also we really don't know what to expect with your cancer. But with the extent of disease I had, I didn't have great chances based on kind of just if you're extrapolating. And so once I made it to that surgery, I kind of promised myself that I wanted to kind of dedicate the rest of my life to giving back to others as much as I could. And so writing this book kind of feels like it's all part of that. I wouldn't have a story to share if I hadn't have made it to that surgery. And so I want to donate all my proceeds from it to giving back so that hopefully other patients one day will be able to have better outcomes too.
Where can I get one?
um, so it's not published yet. I actually just signed with a publisher, I believe, last week.
What? That's exciting.
It was
Cool.
super exciting. It took a while to get there. But so it will most likely be published next year. But I have a website that has like all my socials and kind of everything that I'm doing. And it's katiekickscancer.com. Oh, looky there.
Yes, I got it pulled up.
And
If
so
you guys go
very
to Katie Kicks Cancer, you'll be able to stay in touch with her. She has an awesome podcast that just finished up a series on radiation therapy. So you may find that you can follow her on any of your favorite social media platforms to stay in touch.
Yeah. And so my sample chapter of my book is actually up on that page, as well as there's a link to sign up to be notified of when the book is released through there as well too.
Awesome. Talk to us a little bit about your podcast. You have a co-host, don't you, that also is a kidney cancer warrior?
So she doesn't have kidney cancer. She actually has a sarcoma. But she also was diagnosed with an advanced stage when she was initially diagnosed as well. And sarcomas are rare cancers as well. And so we started a podcast with a radiation oncologist to basically have candid conversations around cancer. Julie and I, the other patient, and I both had so many questions as we were going through the process. Like we talked about in one of our episodes, what it was like to have our case go to tumor board, which is basically where a bunch of doctors sit around and kind of evaluate your case. They oftentimes do this with rare cancers to kind of talk about best treatment options and kind of think collectively as a group. And I remember the first time I was told that my case was going to go to tumor board. In my mind, I envisioned this like courtroom or like this board that my case was being pitched to, which was not like that at all, right? Like they're sitting, a lot of them were probably on Zoom at the time, but it's normally kind of just like a meeting. And so Julie and I kind of talk about those kinds of things on the podcast where we ask the radiation oncologist what it's like and we share kind of what our thoughts were. Or one of the things I wondered was, why am I not getting a PET scan, for example, when I was initially diagnosed? Because everybody I knew that had cancer, which were different kinds of cancers, always got PET scans. And so I was like, why am I going for a CT? So we talk about all those kinds of things on the podcast. It's just a very casual conversation where we kind of just, we share a lot of insights from being patients with Matt, the radiation oncologist. And then Matt shares a whole bunch of insightful information and teaches us, which is what the radiation series is all about, is teaching us about radiation and in that kind of format.
Love it. Yeah, if at the very top of her website, and again, it's katiekickscancer.com. If you click on podcasts, you'll find Oncology Unscripted here and all the episodes. So awesome. So reflecting on your journey, are there moments or experiences that stand out to you as particularly meaningful or transformative? Could you share one of those with us?
Yeah, there's been a lot of them. And so there's like everything from, I had some pretty transformative interactions with providers that really reshaped my experience with the medical system, which I do think influenced part of me being able to learn and part of what my outcome has been. Because I didn't have the best relationship with the medical system when I first got diagnosed, right? I had a really hard time getting people to take me seriously. But I had that ER doctor who gave me my initial diagnosis that gave me such a level of compassion that I had never seen from another doctor before, that really kind of shifted my perspective and made me realize, like, okay, nobody wanted this to happen. but there are people on my side. And I, instead of being upset with them, I could figure out how to reframe my perspective to either give somebody something to learn from and I could work with them, or I could be kind of bitter and just wander away. And I chose to work with doctors, and that's given me a lot of opportunity to be able to talk to doctors and researchers and learn about my case and diagnosis, which ended up being very pivotal in my outcome because I was able to learn so much more about my disease. As well as I mentioned, kind of connecting with other patients, especially the chromophobe patients. That was really pivotal to me and helped give me an insight of kind of the problems that people with rare cancers face. And that completely shaped everything for me, right? I ended up starting my own nonprofit to be able to fund research for it. And then I recently, just 2 weeks ago, started a new job at the Rare Cancer Research Foundation to be able to like kind of even align my day job with giving back and being able to help move research forward for rare cancers. So those are probably two of the many, many pivotal moments I feel like I've had.
That's awesome. Is there anything that you wish that you had known or advice that you would give to yourself at the start of your journey through this?
Yeah, that's a great question. I think probably the biggest thing that I probably would have told myself is that like to stand, to believe in myself, and like to, if I wanted to get a second opinion or anything like that, I'm somebody that really struggles with conflict. And before I started sharing on social media, like I'm normally a very shy and very introverted person normally. And so it was really, really hard for me to get up and start advocating for myself. And I was very, very intimidated by doctors and never wanted to question their opinions. And so, but it was crucial in my outcome. And so if I had any advice to myself at the beginning, it'd probably be that like doctors aren't that intimidating, and actually they want you to be asking questions and want you to be involved in your own care. And so probably knowing that up front would have helped me save me a whole lot of stress that I probably didn't need to have, as I was like really worried about offending people. I know one of the biggest worries I had in my head was like, I don't want to offend my doctor because like they're my doctor, right? They're controlling the outcome of my literal life.
Even when your life is on the line, you don't
Yes.
you don't want to, you know, I think it's something that a lot of people struggle with. And you're not the first person I've heard share that. And I'm glad that you're able to recognize that in you, because maybe someone listening today will recognize that in themselves and not be afraid to ask those burning questions that they have.
Yeah. And I've found that
And
doctors,
get a second opinion. Please get a second opinion. How many times second opinions have saved people's lives? I mean, I've lost count. So it's worth it.
100%.
Is there a message or encouragement that you'd like to share with others who may be currently battling kidney cancer or facing a similar diagnosis before we hop into Q&A?
Yeah, I think probably my advice would just be probably a couple things of like, don't give up hope. I think hope is really, really important. At the beginning, I didn't really have a whole lot of hope, and I didn't have the best circumstances, but I kind of turned to looking to other patients, and that gave me a lot of hope. Even if I didn't think my outcome was going to be what theirs was, I never imagined I'd be here right now. But even having that hope gave me something to look forward to every day.
Mhm.
Um, as well as like kind of what I mentioned earlier of kind of make the most of every day and kind of the time that you have now. It can be really easy to get caught up and lost in planning in the future, or even planning short term of like, what am I going to be able to do next month, or being really stressed out about that. I think especially patients on treatment, like you've got to give yourself some grace, right? Treatment is hard and side effects are hard. So you've really got to make the most of the good days and make the most of the time that you have. So if you're feeling really well one day, go out for a walk. And if that is literally a walk to the end of the street, that's a win. Don't beat yourself up over it. I had walks that I literally would go out for a quarter of a mile And then I would go back in the house and say, okay, I got to walk in today. Like I got outside. It wasn't about needing to walk 3 miles. It was
Doing
about
what you can.
exactly. And so
Mhm.
I think that's really, really important. I think, especially where I'm at now, I think some patients can look to me and feel like they might should have to like be able to have maybe the energy level that I do with the things that I do. But I'm able to do all of those things because I'm not on treatment. And when I was on treatment, like giving myself grace was the most crucial part. I think that's important there.
Katie, thank you so much for donating your time today to talk with us about your journey. We've gone over a little longer than I anticipated. Would it be okay if we open it up for questions?
Yeah, absolutely.
Awesome. So if anyone would like to ask a question that hasn't, the people who've already asked questions, we're going to go through those now. But if anyone has another question or thinks of one in the next few minutes, you can type it into the chat and we'll make sure to get it answered for you. Let's see, starting here. Thank you, Tracy, chimed in on a couple of these questions. I appreciate that. And Shelley says, I'm 2 years out from radical nephrectomy and adrenalectomy, and 1 year out from a year of immunotherapy. I still have debilitating fatigue and immunotherapy, osteoarthritis, so she has daily pain. Have you had to deal with the fatigue in particular, and how do you deal with it?
Yeah, so like I said, where I'm at currently, I don't really deal with any fatigue, and I realize how fortunate I am there. While I was on treatment, I definitely did have fatigue. There were some days that like it was hard to just get out of bed. Some days I'm pretty sure I worked from bed because I was just tired and exhausted. And then as well as when I was, especially when I was recovering from surgery, surgery really did take a lot out of me, and there was days that I felt like I was never going to get better. I was very dramatic to my husband at times. I'd be like, I'm going to be stuck like this forever and I'm never going to get better. Usually through a stream of tears, because like when you feel like you've had a life that was taken away from you, but now you physically have like what feels like your body taken away from you, like it can feel just crushing at times. And so I'm very fortunate that I don't deal with that currently, but I did definitely deal with that at a certain period of time. And like I said, what helped me was not focusing on doing the things that I used to be able to do. Like I said, before I got diagnosed, I was walking like 10 miles a day. But on the days that like I was kind of crushed by the fatigue of it all, it was, did I just get outside? Or did I go for a 1/4 mile walk? Some days I couldn't even go for a walk. And so it was, I'll lay in a hammock. That wasn't quite the way for my surgery because I couldn't get myself back out of the hammock. But when I was on treatment and just didn't feel like I could do those things, sometimes it was just like getting outside and getting into a new environment. So I definitely can kind of empathize with some of that, and kind of say, just make sure you take time for yourself, and like acknowledge the wins, even though they may not feel like wins compared to what you used to do.
Yeah, and going back to what you just mentioned previously, giving yourself some grace and getting out there and doing what you can do. I mean, a lot of depression gets wrapped up in this too, with not getting out and exercising and then just getting sun. I mean, we don't. I think I don't think a lot of us uh, think about how just getting up and moving and getting out in the sunlight can really improve the way we feel, and a lot of that, not all of it, but a good bit of that fatigue can be helped by your mood getting improved. So I we do empathize with you, Shelley, and I'm a religious person. I'll pray for you. I really believe in the power of prayer and setting your intention, and so please don't give up. There's always hope. Sherry shares with us. I was misdiagnosed 12 years ago. I had treatment, which was very difficult. I had a genetic testing shown Bert-Hogg-Dube syndrome, which is rare and caused my renal cancer. I have papillary 2 cell type, and there was no treatment available 12 years ago. I had numerous surgeries, leaving me with a large hernia and a lot of pain. I agreed to be part of a worldwide program to help others with my type of cancer. So now I'm a barcode. I think that's a joke. That's a good one. I'm currently in treatment and someday hope to be in ED. And we hope that for you as well. Thank you for sharing that, Sherry.
Yeah, definitely. I can, they thought I had BHD as well when I was initially diagnosed because it can cause oncocytomas. So I definitely am familiar with that, and definitely know what it's like to join a study. I'm a study at the NIH, and kind of fall into a lot of the same categories that get studied with BHD.
And Katrinka, who chimed in after, she also has BHD, and she's please advise what treatment was working for you. Right now, I only have right kidney remaining with something blocking my screen. I can't see, with 2 tumors. Doctors want to wait and watch. I'm going to a symposium in London on BHD in October. So, what treatments were working for you?
So for me, like I said, I didn't end up getting diagnosed with PhD. They thought I would have it just because of my young age, the fact I did have an oncocytoma, and because BHD can cause oncocytomas as well as chromophobe kidney cancer and some other types as well, papillary. So I did not end up having BHD, but for my metastatic oncocytoma, which we didn't actually end up finding any like specific mutations for that caused it. I don't have any known genetic mutations. I was on cabozantinib, which I did respond to, but what got me to where I'm at currently is because I had an oncocytoma specifically, and because they thought if it had gone to my liver, if they could get it all out of my liver and out of my kidney, maybe it wouldn't go anywhere else because oncocytomas are normally benign, as well as when you resect for certain patients for chromophobe kidney cancer, if you resect just one tumor in the liver and it hasn't gone anywhere else, sometimes they can also reach NED as well. So that's what based my surgery on. And I actually go to the NIH, where I'm part of a lot of several different protocols at the NIH where they study it. And so treatments that worked for me probably won't work for other people, just because my cancer is different. But I will say the NIH, the National Institutes of Health, and the National Cancer Institutes really studies things like Bert-Hogg-Dube and rare kidney cancers. And so getting in touch with them, they also accept international patients as well too, and they don't accept, they're a government entity in the United States, or they're government funded. So for example, my insurance is never billed when I go there. It's kind of all funded through the government, and they study these rare types of cancers. And so while my treatment might not be the same, I definitely recommend for people who have genetic cancers or rare kidney cancers that it may be worth getting a second opinion from the NIH, as well as the watch and wait approach can be a good approach as well too, if those doctors advise for it. For example, I'm on active surveillance, even though we had those spots in my liver. And sometimes it can be good not to intervene with something if now is not the time to intervene with it too. So definitely lean on your doctors and second opinions for those kinds of things.
Thank you. Sherry said, I would advise new patients, you must know your cell type. It guides the course of treatment.
Yes, 100%.
And then Sherry number 2, Sherry Eaton, she says, do we know what causes oncocytomas? I also have AML. I'm not familiar with AML. Are you?
Yeah.
Is there a connection?
I don't know if there's a connection between the two. They're pretty different on the spectrum of tumors. AML is also another benign tumor, I believe, AML. That's the stands for what I think it does, which I won't pronounce it because I'm really bad. I can pronounce things like oncocytoma and chromophobe that I have learned, but I cannot pronounce.
You can't pronounce acute myeloid leukemia?
Here we go. Okay. Well, that's
I
actually not
Googled
what
it.
I was thinking what it was then. There's a benign tumor that starts with an A that can also grow in your kidney, and I thought that's what they were referencing, but it definitely is not. Um, they are still
Spelled
trying
the
to
wrong
research
way.
oncocytomas. The NIH researches oncocytomas, as well as a couple other institutions. It starts from the same cell of origin as chromophobe kidney cancer, for example. So that's part of the reason why those two are related, as well as they share some other commonalities. I haven't heard of any similarities with acute myeloid leukemia, though. um, I was afraid I was going to butcher that. I butcher so many medical terms; it's not even funny.
It's okay.
So yeah, I'm not certain on that front.
Um, Sherry Mills says, I've been on Cabo and Opdivo for 2 years. I still have tumors which are growing in small amounts. The doctor wants to continue this course and watch closely. I was told that Cabo was best med offered at this time for papillary cell. You know, the we're just two people who care a lot about this. We're not doctors. We can't give a lot of that type of advice. But what I would say is that it can't hurt to get a second opinion if you've been on that medication for 2 years and you feel you know how your body feels better than anybody. And if you feel that this may not be the only thing that can help you, it's worth going out and getting a second opinion.
Yeah, I'll definitely say that second opinions are always like I always recommend second opinions to people for the same reasons. There's and also to look up trials as well too. Like your doctor might be mentioning that because of like a trial for papillary kidney cancer that they had responses from cabozantinib. And so a really good thing to do is to look up the trials for the medications of the drug that you're on, along with your subtype, and then be able to take those trials or ask your doctor about them, and they can help as you go for your second opinions. They can help give you that context. Like we said, we definitely, I can't give medical advice. I definitely am not a doctor at all. But everything that I have learned has come from kind of finding studies or, for example, the NCCN guidelines are also something that doctors use to help guide their treatment. I believe that actually just got updated as well for kidney cancer. And so using those resources, if you look at them, they can help you have those conversations with your doctor. And so I highly, highly recommend that because they'll be able to tailor their advice to your specific subtype and case based on that.
And Sherry Eaton corrected me. It's angiomyolymphoma, which I just proved in real time why you shouldn't be Googling your diseases. Go ahead.
That was exactly what I was thinking of. And so that's why I knew I was not going to be able to say that, right? But that is another benign growth that can grow on people's kidneys.
All right, a couple more here, and then we're going to be out of time, unfortunately. Let's see here. We have John who says, "I have chromophobe RC. Here's an easy one. Eosinophilic subtype. I have been offered carbo. I haven't taken it. Radiation has kept me going for 6 years. How do I get a NIH second opinion?"
Yeah, so the NIH is actually really great with their contact information. So this outside of my website as well, which I actually should link over to it. Over the summer, I actually built a resource for chromophobe kidney cancer, and I'm actually going to expand it out to other rare kidney cancers as well as just other rare cancers. But it's called medresourceconnect.com. Or even if you just Google Med Resource Connect. I built that for chromophobe kidney cancer. And it's a page that consolidates all of the latest research, the institutions seeing it, providers, any responses to trials that have been in there, consolidates everything all into one place. And in that resource, there's a link to 2 NIH doctors that you can link to, and their contact information is on those pages when you link out to them, as well as the institution. There's an institution section that tells you the institution studying chromophobe kidney cancer. And if you click on that link, it'll take you to the NIH as well too, and you can request an appointment through them. They don't do, last time I checked with them, they didn't have any trials for metastatic chromophobe kidney cancer, but that's always changing. And as well as like if you resect tumors and stuff like that, they can definitely study that. So I definitely always recommend getting a second opinion because so much changes all the time. So it can still be good to reach out to them.
Mm-hmm. So Christine Collins from Kidney Cancer Canada says, "Hi, Katie. I'm a big fan and so grateful for you and all the work that you do for the global kidney cancer community. We're all in this together in strengthening the patient voice and sharing information to help patients."
Thank you, Christine. That means a lot. I was actually just thinking about you yesterday and that I needed to send you a message. So that means a lot to me. Thanks.
And I would like to echo her sentiment. We're very grateful to have you on the. I don't know if I should call this a podcast or a show or the kidney cancer conversations that we do monthly. Thank you so much for joining us. It's been a pleasure talking with you. And if anyone missed any portion of this this recording, it will be on our YouTube channel and our website starting on Monday. So please look for it there. And thanks again, Katie. It's been a pleasure.
Thank you so much. I really, really appreciate it. And thanks for everybody who joined.
Christine says, "Me too. I think she's amazing." So you made some fans. Awesome job, they say. Have a great day, Katie. And bye, everybody.
See ya.
Oh, one last thing to the people that are still here. We do have we're having a caregiver connection talk this evening with Jayla Barnes. So if you, and it's not just for caregivers, but that is what the conversation is centered around. If you or a caregiver that you know would like to join us, we'd love to see you. You can find it on our website at jnfkidneycancer.org. Thanks again, everybody. Have a good day.
That's awesome. Thanks.